Welcome to the Big 30 campaign, where you get to learn all there is to know to stay free from breast and cervical cancers, ask questions in 20 minutes, and finally book an appointment to have the screening done in just 10 minutes, which makes it 30 minutes in all. Congratulations, you're about to start your journey to total health. What if I told you that condoms do not protect against the transmission of HPV? HPV, by the way, is short for human papilloma virus, the virus responsible for cervical cancers. The virus is transmitted through sexual contact, yet it can be prevented using a condom. How is that? I'll be telling you in this very short video. Do you also know that having multiple sexual partners is not the cause of this disease like many think? Whether 1, 2, 3 or more, a lady still stands the risk. I never took the issue of breast and cervical cancer seriously until I attended the Health Platform seminar. The event was an eye-opener for me. I had both my breast and cervix screened. Now I know how to perform a proper self-breast examination, and I do it more frequently. Just like Princess once thought, you probably think the same too. This short video will not just tell you why screening is important, but will show you why you must begin to take these things seriously as well. So let's get to it. What are the numbers? It's so easy for a lady to say it can't happen to me, but the truth is a lot of women still suffer from this disease. In Nigeria alone, there are 14,000 cases annually, so every year 14,000 women get to suffer from this disease, a preventable disease. How about breast cancer? It is the most common form of cancer affecting women worldwide, and in Nigeria alone, over 100,000 women are diagnosed with this disease every year. Again, a preventable disease. So as far as we're concerned here at Health Platforms, we think it's basically a waste of human lives. Women in Nigeria or anywhere else should not be dying from a disease that is 100% preventable. So this video will be telling you key facts and also showing you pictures, some of which you may find to be graphic, but it's just for you to understand the impact of these diseases and the part you need to play as a lady in making sure you completely prevent this disease for life. So what is breast cancer? Breast cancer is a disease in which cells in the breast grow out of control. And how does this happen? Let's look very closely at this picture. Breast cancer doesn't just happen, it starts from somewhere. Looking at this picture, you can see the different stages it goes through, from the point where it is barely noticeable to where it's grown to about 1 inch, 2 inches, and then starts spreading until it gets worse to the point where it starts to affect other organs. You can also see that as it progresses through different stages, the survival rate drops significantly. So when we say early detection is key, this is exactly what we mean. The earlier you detect it, the better. Many women do not even notice these changes in their breast at all. We have had a lot of ladies come to the clinic to report the presence of a lump in their breast, and when we ask further questions, we find out they didn't even find the lump themselves, their husbands did. For some of us, the only time we get to touch our breasts is when we're wearing a bra, having a bath, or taking off the bra, and it shouldn't be. And this is what it looks like in reality. Here you can see the changes in this lady's breasts, a lump, and then the texture of the skin. This next picture shows a lady who is beginning to have bloody discharge from her nipples and sores on her breasts. How about this? You can see how the texture of the breast looks. It practically looks like the back of an orange. And this is called dimpling. I guess you also see the huge lump as well. And then this, sadly, which has grown worse. A simple breast examination and routine screening could have saved all of these ladies because they would have detected the abnormalities in their breasts early enough. No one knows the cause of cancer, it just happens. And some, like breast and cervical cancers, can be prevented. For breast cancer, however, there are risk factors. Factors that can predispose a lady to having to suffer from this disease. You have gender. Being a female with a pair of breasts already puts you at risk. Men also have breast cancer, but it's just 1% of all breast cancers. The rest happens to women. You also have family history. So if a lady has a sister, mother, or aunt, a first degree relative who have suffered from this disease, such a lady is at a higher risk. And then you have smoking, poor diet, overweight, and excessive intake of alcohol, which also stands as risk factors for other diseases as well. So what are the signs you should look out for when performing a breast examination? The most common sign is obviously a lump, but do you know there are other signs you should look for as well? Inverted nipples is another sign. So as a lady growing up until now, you've always had your nipples pointing outwards, and then all of a sudden it starts going inwards. You should report it. You also have dimpling, just like the lady's picture I showed you initially, where the skin around the breast looked like that of the back of an orange. You have drippings, otherwise known as discharge from the nipple. It's another sign, especially when it's bloody, redness or rashes, and skin changes. When we called the numbers earlier, it looked really huge, right? How about we look at case studies of people whom we may actually know? Here is Aishat Abimbola, who used to be a Nollywood actress, died at the age of 46 to breast cancer. A very sad story. In this next picture, we have Angelina Jolie. I like to call her as the bold step. She had a family history of breast cancer, and then she thought to herself, why do I have to live this life wondering if I'm at risk? And she went to the hospital and took off her 2 breasts in a procedure called a preventive mastectomy. In her own words, she said, I can tell my children that they don't need to fear they would lose me to breast cancer. We also have Mrs. Betty Akeredolu, who is the First Lady of Ondo State. She says, I choose to remove my breast to survive breast cancer. Hers was a story of victory. She went on to say in an interview, like I always tell women, surviving breast cancer is all about attitude. If you lose it, it can be very difficult because some women, immediately they are told they would lose their breast, are already gone. Some of them will say their husband may marry another woman with 2 complete breasts. The man shouldn't be on the radar. Rather, the woman should be more concerned about their children. They must do everything to live and take care of the children because they cannot tell the character of the woman that their husbands will marry. What Mrs. Betty has said is the truth because as women, we tend to care about everyone and everything else, often neglecting ourselves. Your health should be your priority because if it happens, all other things wouldn't even mean anything at all. Just before we talk about cervical cancer, I want to take these 5 seconds to ask you the question, what do you want? You don't have to sit back and just say it's not my portion. It won't happen to me. You have to take steps, which means that you have to start examining your breast yourself and also go for routine mammograms or even a breast scan if you suspect any abnormality so as to detect these changes on time when the survival rate is still almost at 100%. What do you want? Now let's talk about cervical cancer. This is a type of cancer that occurs in the cervix. It is caused by the human papilloma virus, HPV. And how does it happen? The virus is sexually transmitted. First off, before I start explaining, I would like for us to understand what it means to be sexually active. When people are asked the question, are you sexually active? Some say, no. For the past 3 months or 5 months, I haven't been sexually active. The question really is, have you ever had sex or engaged in sexual activity? If the answer is yes, you're sexually active, even if it was just once, and I'll tell you why as we move on in this video. Some other ladies think because they haven't had penetrative sex, they do not stand the risk. The virus is transmitted through skin-to-skin contact, and that's why a condom cannot prevent the transmission of the virus. The virus can be found on areas other than the genitals itself, like around the genitals. So even if you have just been playing around, you still stand the risk. Guess what? Nearly all men who are sexually active have this virus, but they do not have a cervix, so it's right to say they are not at risk for this disease. But the women with whom they have sexual intercourse are at risk. So simply put, if you've ever had sex, you're at risk and you should have a screening as soon as possible. Just in case you're wondering, where exactly is the cervix? This right here is the cervix. This is an image of the female reproductive system. From the vagina, next up is the cervix. It's the neck of the womb. Just like breast cancer, cervical cancer doesn't just happen as well. A HPV infection left untreated will progress through different stages and eventually turn into cervical cancer. From having a completely normal cervix like you can see in this picture to having a cervix with invasive cancer takes about 5 to 15 years depending on a woman's immunity. For some, the infection clears up on its own, but for some others who aren't lucky, it progresses through these different stages. So how does a woman know where she stands? By having a cervical screening performed. The screening checks for abnormal changes on the cervix that would have been caused by the HPV virus, and if these changes are found, it's treated, after which a lady goes back to having a healthy cervix. This infection does not show any signs at all, especially at its early stages. However, some women have reported having pain during sex, low back pain, bleeding after sex. Many women experience this but tend to just look away thinking it's normal. They think it's just the impact of the sex. Bleeding between your menstrual period. So as a lady, we all should have a menstrual cycle length on an average 28 to 35 days. So you know when to expect your period. If, for example, you have a 30-day cycle length, you see your period on the first day of the month, you should be expecting your next period on the 30th of the same month. And then all of a sudden you bleed from the 1st to 5th, and on the 15th, you start bleeding again and you think maybe the period didn't come completely the first time or it's chosen to come back earlier. It doesn't happen that way. If you notice any of these signs, please report to the doctor early enough. You also have excessive vaginal discharge. The fact that you experience any of these signs does not mean you have cervical cancer. Like I said, these are early signs. And then again, these signs are also common to other diseases and infections as well, which makes it very important for you to check to know what the problem is. On the left is a very healthy cervix, and on the right is one that is not. Can you see the tiny hole at the center of the healthy cervix? That's the squamocolumnar junction. It's the same place your period comes out from. A healthy cervix is meant to be nice and pink, just like this. But on the other hand is an unhealthy cervix. Can you see the white patches? These are changes caused by the HPV. It often starts from the squamocolumnar junction, and over the years, if it's not treated, it spreads and then turns into cervical cancer. Earlier, I spoke about bleeding during sex, if you remember. Because of these changes, the cells here have become very weak, and any little touch, in this case, which will be sexual activity, can cause a woman to bleed. Usually, when you have a visual inspection cervical screening, you get to see your cervix on a screen with these changes, if there are any. Like we always say, you do not need to be scared. This is a preventive screening, meaning that even if changes are found on your cervix, it can be treated. It is when a woman never has a screening done to notice these changes early enough that it progresses into cervical cancer over the years. Remember, early detection is key. You need to get screened. The earlier, the better. This is Tamika Felder. She's a survivor of cervical cancer. She survived cervical cancer at the age of 27. The infection had spread to more than just her cervix at the time, and as a result, had to have a hysterectomy to remove her womb. Many times we think we are too young to suffer from certain diseases. Many years back, it was common to see older women suffer from these diseases, but now it's no longer like that. So does age really have anything to do with it? It doesn't, and I'll explain why. So remember when I explained what it means to be sexually active? Some ladies were exposed to the virus at a very young age. How? Some had their first sexual intercourse very early in life. Some intentionally, others were abused and couldn't even confide in anyone. Let's imagine a lady had her first intercourse when she was barely 15. Remember I said it takes about 5 to 15 years for the infection to progress to cervical cancer. Now add this time to just 15 years. It explains why a lot more younger people are suffering from this disease. A disease that can be prevented simply by having a screening, having a treatment done if there are any changes, and then getting vaccinated to protect yourself from the virus. So let's move to prevention really quickly. How do you prevent breast cancer? Self-breast examination. Some people will ask, why do I have to do a self-breast examination? Should I be looking for cancer? No, you are not. You are doing it to know how your breast feels normally, so the minute there's anything unusual, you will catch it early. If you don't know how to, it's okay. We will teach you and also have it done for you when you visit the clinic. It doesn't end there. We will also give you a breast examination reminder card that will not only teach you how to perform a self-breast examination, but also remind you to. How about that? Cool, right? Next, you have the mammogram. This is an X-ray of the breast that can be used to detect abnormalities early enough. Women over 40 are advised to have it done once every year. And then a breast scan. It's also an imaging test done for women below 40. If a doctor suspects an abnormality, this can be used to give the doctor more information. If a mammogram also doesn't give the doctor enough information, a doctor can also opt for this test to be done. And then we move to preventing cervical cancer. We're almost done. The first is getting a cervical screening. Like you already learnt in this video, it checks for abnormal changes early enough. It is very quick too, the same way you go for a swab test. A speculum is inserted and a device is used to view the cervix. Did I mention you get to see your cervix on a screen? Interesting, right? And in 10 minutes, you're done. So what next after a screening? If your cervix is fine, you'll be given a 1 or 2 year appointment. Depending on your result, if changes are found, you'd be advised to undergo treatment. The treatment is called cryotherapy. The precancerous cells, which are the infected cells, are destroyed with liquid nitrogen, after which they come out as discharge and then the new healthy cells grow to replace them. You will only have to avoid sexual intercourse for about 2 weeks. No tampons or inserting anything in the vagina. You just leave it to heal. It's that easy. The last is vaccination. Vaccines to protect you from the virus that causes cervical cancer is available. Do you know it is also available for girls from the age of 10, as it builds their immunity against the virus before they become sexually active in the future. For ladies who are already sexually active, you will need to be screened first and treated if there are any changes before taking the vaccine, because it only protects you from the strain of the virus you haven't been exposed to. In this picture is our nurse vaccinating a mother and daughter. So if you have a daughter 10 years and above, you can protect her and yourself. Some of us are also bothered about cost, pain, etc. But Shubomi's testimonial will get you thinking otherwise. She says, I have always been aware of the importance of breast and cervical screening, but scared of the result and findings. When I heard about the affordable screening health platforms was offering, I decided to get myself checked because prevention is better than cure. I was nervous going in for the screening, but they made it very comfortable for me and it was absolutely painless. Their service was very professional, seamless, and highly affordable. Having a screening with health platforms is highly recommended, Shubomi. The cervical screening isn't painful at all, and it is so affordable you won't believe it. Talking about cost, let's introduce you to the offer I will be giving you today. The offer, valid for the next 48 hours, will provide you with a clinical breast examination, a cervical screening, HIV, hepatitis B and C test, 20% discount off vaccines, and health information materials, including a yearly breast examination reminder chats. Why are the other tests important? Just like HIV, hepatitis can be sexually transmitted. It can be transmitted through blood, semen, and other bodily fluids affected by the virus. It is a viral liver disease. From this picture, you can see how bad it gets when it isn't detected early and nothing is done about it. People often fear HIV, but I tell you today that hepatitis is much worse. Hepatitis B cannot be cured, but it can be managed to avoid complications. There are also vaccines available for you to stay protected. So why not? So what is the alternative? Just before we tell you the cost, cancer treatment costs an average of 30 million naira in Nigeria. A chemotherapy costs 300,000 naira every 3 weeks. Radiotherapy, on the other hand, costs 600,000 every day for at least 5 weeks. Now, the figure 3 you see by the side is the number of radiotherapy centers that are available in Nigeria. You have one in Lagos, Ibadan, and Abuja. So, Let's say a lady has the money to even go through these treatments. It becomes a struggle to get an appointment to actually have the treatment done because the centers are too few. How about a mastectomy, the procedure to cut off the breasts? It costs at least 500,000 naira. So, on an average, a woman will spend 30 million naira to treat herself for a disease that can be prevented. So, if it can be prevented, why then are people dying from these diseases? Because people are not taking the necessary steps. Why not? So, today we're bringing again to you the offer. You'll be having a clinical breast examination, cervical screening, health information materials, hepatitis B, C test, the HIV screening, and 20% discount on vaccines, all for 4,000 naira. Now, this would originally cost about 8,000 naira. You're having it today at 50% off for just 4,000 naira. However, if you do not want to get the full package, we also have that will be giving you clinical breast examinations, cervical screening, health information materials, and a hepatitis B test. With 40% off, instead of having it at 5,000, you get it for 3,000 naira. Just 3,000 naira. This offer is valid for the next 48 hours. Now, we have something else. Let's say you come with a friend, you get an upgrade to the full package. So instead of the both of you paying 16,000 to have all of the tests done, you pay just 7,000 naira, 3,500 naira each. So come with a friend and you get an upgrade. Information to make payments is just below this video. You have the link to make online payments. You can also have bank transfers as well. If you choose to do a transfer, you can get a screenshot of your payment detail and send to our WhatsApp number. Now, the link to our WhatsApp is just below this video as well. So once you click it, it takes you straight to the chat page. The offer again is valid for the next 48 hours and it will be off. If you have to walk into the clinic to have any of these tests done, you would have to pay the full price. So why don't you take advantage of this offer and get an appointment in less than 2 weeks? Now, here's what Vera thinks. A very happy patient from our clinics. So she says, it was really a learning experience for me. I've been procrastinating about doing it for the longest time, and I'm glad I didn't miss out. The truth is, many of us are like the old Vera. It's probably not the first time you've heard of breast and cervical cancers. You just keep saying, I'll do it, I'm busy. If you never make out time, you will never have it done. And once you're done, trust me, you'll be glad just like Vera. Remember, it doesn't take time at all. I mean it when I said 10 minutes. Prevention is better and cheaper than cure. Here's our offer again for those who are ready to take the next steps in order to prevent these diseases in their lifetime. If you have any questions at all, there's a link just below this video with all of the contact information, including a link to our WhatsApp. You can always chat us up at any time to ask questions. If you make payments, we'd like you to send your name and the proof of payment to the same WhatsApp chat. We'll be glad to have you. Cheers once again. Have a great day. Bye.